Pharmacists can help you parents with problems like teething problems, colic problems, when your kid is sick with cold or flu, when your kid has GI problems like diarrhea or vomiting, when there are mosquito bites or different rashes, lice prevention or lice treatment, treatment for aches and pains. Vitamins and probiotics do boost the immune system. Probiotics help to fight the bad bacteria in the guts. Vitamins and probiotics help to reduce the impact of the infection. Some gauze and plaster, saline, antiseptic cream or wipes, an eye wash, an ice pack, and a thermometer. Some paracetamol syrup or suppositories, a saline decongestant spray for the nose, some antiseptic cream, cough syrup, some teething gel, some antihistamine cream for bites, and also some probiotics for diarrhea. Giving medication to toddlers and children might be a bit problematic. Something that might help is using a syringe and give small volumes to the child over a short period of time. Also, you can add it to their favorite drink, but before doing that, always ask the pharmacist, since some medication might interact with certain drinks. Something that also helps is positive reinforcement, is praise your child once he actually takes the medicine, so that the next time it will be a bit simpler. For a thermometer, nasal aspirator. Nasal aspirators, you can either have a manual one or as an automatic one that helps you to remove the mucus from the child's nose. Ideally, you train them when they are well, not when they're sick. Train them to blow out of their nose. Another hack that might help is to put them in front of a mirror and ask them to blow, and there will be fog mist forming on the mirror, and it will help them to understand more the concept.